Okay, so with the Marfan's diagnosis, one of the criteria was asking if you ever had a family member that had dilated aortic root rupture or just dilation. And when the genetics counselor sent me that questionnaire and asked that, it triggered a memory that my cousin died early. He was, I'll have to ask his twin sister. Um, I'll have to look through my notes because I don't want to ask her and go through that again. Whether it was so horrible to have to make her relive that. But what happened with him was he had an ATV accident, but the ATV was not going, you know, he went off the ATV and hit, I believe it was a post to one of those freestanding basketball hoops. And it wasn't a terrible crash. And the problem was the extent of his injuries at the autopsy or for the accident itself. Nobody could believe that he would die from that it wasn't a great impact. His injuries weren't that bad, so people were just confused as to how did that kill him, you know? So what happened was he hit the post, and I guess he collapsed. When the paramedics arrived, what his symptoms were was he said he couldn't feel his legs and his back hurt. And so they were thinking, the paramedics were thinking, maybe he has a spinal injury. You know, he said, my legs are going numb, I can't feel my legs, and my chest hurts. So he went to the hospital. I think his blood pressure was lowering, you know, on the way to the hospital. And at the hospital, he was still pretty with it. They were very concerned that he had a spinal injury. So what happened was they sent him into X-ray to see his spine. And what they saw in the X-ray, to their surprise, was all this fluid out around his heart. And they realized his heart was bleeding out. So right away, he went into, sorry, I'm trying not to get emotional. They sent him into surgery. They opened him up. They saw that his aortic root was ruptured and blood was pouring out. So they did the surgery at that time to try to repair it. And what they do is they wrap it in a mesh and wrap the root in a mesh to hold it together so it won't bleed out. And apparently he was too far gone. Maybe his organs were already affected, lost too much blood, whatever. But even though they put the mesh in, they couldn't. He ended up losing his life, and they couldn't bring him back. So his twin sister who was with him, she carries survivor's guilt because she was actually on the ATV when it happened. She was losing control of it. He jumped on to try to brake it or steer it to regain control of it to protect her. And that's when it hit the pole and he had this accident. And when she was talking to the paramedic, or no, I guess it would have been the surgeon, the doctors that saw that the aortic root ruptured, how they explained it to her was his aortic root was ready to rupture. It was very thin and ready to rupture, that this was a pre-existing condition, that even if it had just been a fall down the stairs, it would have ruptured. So they were trying to assure her that it was already severe enough that this would have happened from any impact, you know, whether it was severe or not. So, remembering that this had happened to him, I contacted her, trying to figure out exactly what happened with his heart And sure enough, she explained it was the aortic root rupture. It's very sad, and it's hard to talk about because in his case, it couldn't have been prevented because we didn't know. He never had any tests to look at his heart, and we didn't know we had this history in our family at all. And even though my son was going through symptoms of Marfan's, he wasn't diagnosed either, so we didn't know to test relatives. We didn't know to have anyone tested for such a thing. Sorry. I'm trying to make this video diary to help other people that are going through it. And I'm actually having surgery on my heart, so I have other videos because I'm making a video diary for my situation and my surgery and my recovery. But so anyway, this is about my son's diagnosis. And so when I called my cousin, and she told me how her brother actually died, and we were able to obtain copies of his autopsy report. And I was talking to my cousin about his other symptoms, about Marfan syndrome, and what my son was going through, and what the symptoms were. And she was telling me about his symptoms that he had for this disease, and that she has for this disease. And again, no one thought to connect any dots with anything. So her dad and my dad are brothers. And that's where we think this connective tissue is coming from my dad's side of the family. Her dad is very, very, very tall and lanky. I don't know. They're not close to him. He's not close to my family, their dad. I just knew him as Uncle Davy. I don't know. I'm not in contact with him to get any information on him. I do know he's very tall and skinny. And when I look at pictures of my dad's relatives, he has like 8 brothers, or maybe he had a sister and like a whole bunch of brothers. And half the brothers, some are very tall and skinny, and some are short and stout, I would say. And my dad was skinny, and my Uncle Davy, this uncle that I'm discussing, he was very tall and lanky. I think he's probably the tallest one. And my Uncle Dennis is tall and thin, always tall and thin. And like not just average tall, like beyond tall and looking skinny. And this tall, gaunt look is something that like people think we're not getting fed right. My mom was accused of starving me by my grandma. I don't know if I already said that in this video. My son, when he was a toddler, this obese pediatrician tried to diagnose him as having failure to thrive because he was too thin. And thank God the other pediatrician, he wanted to put him on steroids to try to get him to increase his appetite and gain weight. And this other pediatrician in the practice said, no, you're skinny and thin. Your nephew's skinny and thin that she also saw. She said, I know he's skinny and thin, and it's hereditary. This isn't failure to thrive. That's just how your bodies are. So although they knew he was skinnier than normal, it was normal for our family. So she wasn't concerned about it. So let me see. Talking about my cousin that died with the dissected aortic root. His other symptoms that he had was, you weren't supposed to, like Trevor's on these, my son is on these restrictions to restrict activity so the root doesn't get worse. Well, this cousin of mine, he would weightlift because, he was trying to build his body up. So he had excessive weightlifting, which probably made his heart worse because we didn't know. And another symptom he has and his sister have are crowded teeth, a high arch in their palate. I don't have this, and my son doesn't have this, but it's a symptom they have. I don't know what my cousin's height was. I know his twin sister is shorter. She was always shorter, So, you don't necessarily have to be tall to have this or have the symptoms or to carry this hereditary trait. So that's about it. How my son was diagnosed, and what went on with my cousin. No one else in the family has had surgery to correct anything except my sister did have surgery for a collapsed lung. She had maybe 2 or 3 collapsed lungs during her lifetime, so she had surgery on one. Her son, my nephew, had a collapsed lung, but it corrected itself. He didn't need surgery. I think I might have had a collapsed lung back in high school because of this pain I had in my chest, but after a few days it corrected itself. I didn't tell my mom because it was scary. I didn't know what it was, and I don't know, I guess I was just scared, so I didn't say what was going on, but what I felt was I had to breathe shallow because if I breathed normal, when my lung got to a certain point, I had a sharp pain. Right here, I could still remember, it was like on the left side of my chest in a certain area. And also when I would, at that time when that was happening, if I was bending over doing something and I stood up, I felt like a painful click, sharp pain in my chest. But again, it didn't get worse, and I was kind of just waiting for it to go away, and within a few days it went away. So I don't know if that was a collapsed lung. I wasn't diagnosed with it, so I don't know if that's what it was for sure. My son hasn't had any of those symptoms. I have another son with my son's symptoms if you want to click on that and see that link. So that's it for that video. Thanks for listening. Sorry I was crying. I'm trying to do this video diary and not be emotional, but I want it to be real too. And I want everyone that's going through this to know that you're not alone, that a lot of us are going through similar things, and just do all the research you can, because the more you know about it, the less scary it is. Other people are going through it. They live through it. They have surgeries. It's in my case, my mitral valve repair, I'm just thankful it's something that's fixable. And I am scared, I am nervous, but I know going forward that it's going to be fixed and I'll feel better and I'll be better. And I know with my son's Marfans, he's being monitored, so we're making sure his heart doesn't get worse. And if it does, we'll be proactive and have surgery, And until then, we're going to the cardiologist, keeping it monitored, paying attention and doing his restrictions. He had to get notes for work, so he doesn't overexert himself. The way, he can't lift or push or pull over 30 pounds. He's not supposed to get his heart rate up past 130, I think, either. He's not on anything. He doesn't need to be on any beta blockers yet or anything. And he's checked yearly, so that's where I'm with him. My daughter's 8. She is also checked on a yearly basis, I think. Right now, she does not have a dilated aortic root. The pediatric cardiologist is the same one my son sees. So she said, you know what, we'll keep an eye on it every year. She doesn't expect that anything would happen until puberty. I guess that's when my sons started growing. That's why when he was 4 or 5, the echo didn't show anything wrong. It's something that usually happens during puberty, where the aortic root starts dilating more. My daughter she didn't seem to have an inverted sternum. Now I'm seeing what might be the start of an inverted sternum, but it might just be because she's skinny and thin and tall and lanky. So her body just might be like mine, but I'm keeping an eye on that sternum to see if it appears like it's indenting more. So that's it. So watch my other videos and watch me through my mitral valve surgery, and I'll keep you updated on the surgery and my recovery. Thanks for watching.